Welcome to the Smiles Are Wild channel, brought to you by Pediatric Dental Associates and Orthodontics. My name is Amy Morgan. We will be bringing you fun and educational videos weekly to help you take better care of your child's oral health care needs at home and on the go. Make sure to subscribe and turn on notifications to see all of our new videos. And remember, it doesn't really matter how you take care of your teeth as long as you take care of them from the beginning.
Good afternoon, everyone. I'm Amy Morgan. I'm the marketing coordinator here for Pediatric Dental Associates and Orthodontics. And today we are going to be talking with you live directly from an actual adult orthodontic patient. So we just wanted to make sure that everyone knew that not only do we offer orthodontics for adults, that we are getting some really good results and some really good feedback from those adults who are having their braces or their Invisalign treatment done with Dr. Jason. So we're going to bring on a special guest. His name is Bryan Fittin. Hi, Bryan. How are you?
Hey, thanks for having me on. This is awesome.
Absolutely. We're so happy you did this. So thank you for taking time out of your day to come on and give us a little bit of an insight of what it's like to not only be an adult patient, but also a male patient. I think the male patient perspective is very important.
Yeah.
I think a lot of dads, like moms neglect themselves in some ways, dads neglect themselves in others. So I feel like this was a huge step for you to start the process. And I know you've been having pretty much a good result with everything and been pretty happy with the services and everything. So we thought you'd be a good fit to kind of come on here and talk to us about what it's been like to have your treatment done. So just for all intents and purposes, whatever, here that Bryan is in Invisalign tray. So a lot of the stuff we're going to talk about today has to do with clear aligners. So we'll go through that here in just a minute. But first, Bryan, if you could just tell us just kind of what your initial experience was like with the actual consult, meeting Dr. Jason and his treatment coordinator and his team. That would be great.
Yeah, absolutely. So it was really cool, actually. We sat down. I had all kind of preconceived ideas of what it was actually going to be like. So just even kind of going back, I had braces in high school. And then as I got into college and retainers were lost and different things like that, like it was harder for me to kind of keep up with it. And so my teeth shifted. And so I've always wanted to get back into braces or something. And obviously when Invisalign came out, it was something that piqued my interest, but never anything to kind of push forward. And so my smile has always kind of held me back, and I wanted to be able to have my teeth straight again. So, but it was really cool. Yeah, we met Dr. Jason, which, I mean, he's a dad as well, so it's kind of fun just being able to have that relation even with him. Like, he was just really cool and very, any questions I had was very open to answering those and kind of laying out the process of what it would look like, what his expectations were, all of that kind of stuff. And so it was really cool. I mean, and honestly, I mean, I'm a dad who likes to have fun at heart. So we have 3 preschoolers, and so we've taken our kids to PDA for a couple of years. And so understanding kind of what it goes on there, I was like, I'm excited to go sit and watch the TVs, and I'm excited to kind of have some fun too. So it was just a great experience, and the staff has been great so far.
Yeah, I think that's one thing we really put into the heart of it when Dr. Jason, when we were redoing the building a few years ago, ortho was a huge spot for the fact that we knew that we would probably be seeing older teens and adults for that. So that orthodontic area is really set up to make adults comfortable as well as kids, with the TV and the screen in the ceilings and everything like that. And it's not as like animated over there. There's one animal over there. But a lot of the area is just strictly designed for the older teens and adults and things like that. So I think that's one thing that parents kind of see as maybe a negative, is they don't want to come to a pedo practice to have their orthodontics done. But really, for me, even I had my braces done with Dr. Jason a few years ago. And even for me, just having that idea that he was working with kids and me at the same time, I knew he was going to be gentle and he was going to be able to work with me, especially with my fears of the dentist and things like that. So I felt like that was a huge advantage to having him do my braces versus another orthodontist who may not work with a lot of little kids. So sometimes that can come in handy, especially as an adult who may have a fear of the dentist. So after your initial consultation, we kind of talked to you about your choices. We probably gave you a choice of probably some clear braces or some clear aligners, or what most people know as Invisalign. We do a couple different options for clear aligners, but you chose Invisalign. And I know you and I have discussed before, but you had a little bit of misconception about what would happen with the Invisalign and things like that. So can you kind of address kind of what your misconceptions were and then how that's kind of turned around and been worked to your advantage?
Yeah, so I think it's one of those things. So I didn't know with, there's Smile Direct Club out there and all these other ones, and they just make it seem like it's just, oh, just super easy. But I've known people that have done that and didn't have very much success with it. And so I think there's a part where it's like there's some accountability with Dr. Jason. I mean, he takes it very seriously, and I appreciated that because he was just like, hey, you're wearing them for 22 hours out of the day is essentially what you're doing. And so putting that kind of like, that's the expectation from him, and that's how I want the best result. Like, I don't want to wear these for the rest of my life. I want to do it and get done and have that smile back that I had before. And so with him kind of setting those expectations and honestly going through this process of putting even just small brackets on my teeth as well, just like I had when I had regular wire braces. And so that was something I didn't expect, but it helps keep the tray in. And that was something that Smile Direct Club, it's all these other people out there never really fully explained, and people that I knew didn't have that. And I think this has actually made the difference to where it feels like it locks in. It's definitely one of those, you get used to them. I think it's one of the things of just kind of like, well, do I get to take them out? How long do I take them out? What happens if I lose them? All those things. And they kind of put a lot of my fears to rest up front. And it was one of those things of like, did a great job of setting the expectations of what to look for. They're mailed to me. I have even my little tray thing here that I take them out and put them in. And
yes.
Can I do this on camera, Amy? Can I take
Yeah, please. We want to see. So we're going to show you how easy it is to take them out and put them back into your mouth. So when you're eating and drinking and things like that, you have to take them out during the day. And so Bryan's going to kind of demonstrate just how easy it is to pop them out and put them back in just quickly.
Quickly, yes. Yeah, now I'm on camera. I'm nervous now, though.
Now you're going to like all fumble it. You'll be
fine. So it is one of those things you kind of have to get used to taking them out, obviously. And so
absolutely.
So
easy peasy.
Yeah, you just kind of get used to it. It's like a muscle memory almost too. And so it is one of those, and then obviously put it in your tray. And so I have one on the bottom. It's kind of the same process of making sure to go through. And I will say, I mean, I do drink with them in, but mainly water, right? So it's one of those things,
right.
Kind of clear liquids and stuff, making sure that no sugar stuff. But it has made, I've lost weight because I've had to drink a lot more water.
People say that all the time. They're always like, it's a great weight loss program.
It really is. It really is.
Yeah. And I think Invisalign has done a really good job with their packaging too. I know the package you originally get when you get your initial trays is really well put together. It's this very sleek design. The cases are really cool now. It doesn't look like the old plastic retainer cases.
Yeah.
So it's a real cool design. So you don't feel like, your teenage self with your old retainer case.
Yeah.
And they've really done up and simplified a lot of that and made it very modern. And then you're going to put it back in super easy.
Sorry. Yeah.
Yeah. You're good to go. Yeah. And I think Bryan touched on a really important point too. One of the things that we really try to stress during any patient that's in orthodontic care is you have to take care of your teeth while you're in the process. So it's not like you can slap the braces on and then not do well at brushing and not eat the right foods and things like that. Like, yes, you're going to have straight teeth, but you're going to have straight damaged teeth. If you're drinking drinks that have a lot of sugar in them while you have your trays in, drinking coffee can stain your teeth. Anything in a dark liquids will stain your teeth if you have them in with your trays in, because the trays will trap that liquid underneath there and will actually sit there and stain your teeth. So that's something that we really stress in any type of orthodontic care, is that you're continuing to take care of your teeth as well as taking care of the appliances. So the appliances are an add-on to everything that you kind of have to clean and take care of, but your brushing habits need to stay the same. Eating healthy foods, things like that help keep your teeth really healthy as well. So I know I've been around Bryan a couple times. I've seen him take his trays out, drinking water. He's a good patient. So you're a good Invisalign patient.
I should get a prize the next time. Do the
We'll
twist.
give you a token. We can't use the thing right now, the
Oh,
little
right.
power right now, so we're just having to hand them to them, and I don't think the kids are as excited about it, but that's okay.
So,
but if you become an adult orthodontic patient at any point, don't you worry. If you want a toy, we will get you one. We're more than happy to do that.
Have fun as parents, right? So,
that's right.
Hey, I'll tell you this. I'll hit on this real quick. So I will say, with taking care of my teeth in general too, I mean, I've actually had to do a better job, because if I don't brush, if I don't floss, if I make sure everything's kind of out of there, I've missed things before and gone to bed and then woken up in the morning where it's hurting because I got a piece of food or something stuck and didn't realize it, and I mean, it is pulling your teeth, and so it is crushing that, basically in there, and so it definitely is. It can be painful. So it's one of those things of making sure to brush and floss, consistently, and mouthwash, all of that to make sure everything is set, because it does make a difference. So.
Right. I totally agree with that. That's good advice, Bryan. So let's talk a little bit about, so one of the things that I think that Dr. Jason and his team have done a really good job at, and I think our office overall has done a good job, is that in March, our state mandated that we had to shut down. So we weren't able to see patients when COVID-19 started hitting the U.S., and we had to really kind of revamp and figure out how we were going to do some things. So Dr. Jason actually jumped right on, and we got a virtual appointment tool added to our website, and you were able to use that while we were closed. So can you talk a little bit about that experience and kind of how it worked on your side, and maybe did it make it easier for you? Was it hard to upload the photos, things like that?
Yeah, I think it's geared more towards the mobile side of things, is what we learned. So I had done it on the desktop. Couldn't find it originally. That was one of those things that was like, where is it? Once I found it, though, it was pretty easy and step by step to go through. And even with me, I wanted to, take the best photos possible, because what was really nice is after I uploaded everything, sent them in, actually Dr. Jason went through, looked at all of them, and gave me some pretty detailed feedback. A lot of times when you do something like that, you're like, is anybody actually going to see this on the other side? They're like, hey, please check this out. But I didn't know who all was going to be looking at it. But Dr. Jason actually went in there and talked about specific teeth and where they had moved, and the progress and stuff that they had made. And so it was, I was actually really surprised with his just quick response, but then also very detailed response as well.
Sure. And I think too, we took that feedback. I think that's one of the things that we pride ourselves on, is being able to take feedback and work from that. And so we were able to revamp how the tool appeared on the website. We put it in a couple different places in case someone was looking somewhere differently, because not all our brains react, the same way. So we're not looking in the same places. So if you are watching and you are interested in a virtual, even a consult, they are completely free, and you can find those on our website at smilesawhile.com. And there's a blue bar on the left-hand side of your screen. Like Bryan recommended, it's best probably to use it on a mobile device, because you can take the photo and upload it right there versus doing it on your laptop or your PC. So mobile is definitely where it's at. And then that email, once all that information is there, that email goes directly to Dr. Jason, and he is the one responding to most of those inquiries, especially for consults. Adult patients he handles on his own. If an assistant has called and asked for a certain item from your child who's already maybe in braces or something like that, that might be answered by the assistant. But 90% of the time, those are answered directly by Dr. Jason. And that does get me on to a little bit of a different subject, which is initially when we did your Invisalign consult, we sent off your records. So can you talk a little bit how the scans worked versus maybe what you remember versus impressions when you were a teenager?
Oh goodness. Yeah. That's so back when I got them ages and ages and ages ago, we're not going to talk about how old I am, but originally when I got mine, it was the gross, goopy, whatever stuff that they smashed in your mouth, and you held there for a long time and pulled it out, and it was a whole traumatic ordeal. But with the scanner that they used, it was super quick. I mean, and then they were able to actually see, obviously, with all the photos and stuff that they did ahead of time, but then also with the scanner just kind of telling exactly what my mouth looks like on the inside. It was way easier, super easy.
Yeah, so we have invested in an iTero scanner, which is basically, it can do all the impression stuff that you used to have to do with the trays and everything, and it does it all with just a tool. We touch each tooth, we scan your whole mouth. It's a very easy process. We even have some videos up of like younger patients being able to do it. So, so it's really intuitive. It's really easy to see. You can see it right on the screen as they're doing all of the scans. And then what they do is they take those scans, they send those over to Invisalign or whichever clear aligner company you choose. And then Invisalign will then make you a model basically based off of that and show you what the progression of your teeth are going to look like. And I know that Dr. Jason had put together a little video for you to show you kind of how they were going to start and how they were going to end up. And he, sent you some messages about that. So I know Dr. Jason takes a lot of pride in making sure that his adult patients are very well taken care of. He does go the extra mile for that situation and always wants to make sure his adult patients are comfortable for everything. So we don't want anybody to think they're going to get lost in the shuffle or anything like that. Like, adult patients are definitely taken very well care of.
Yeah, I apologize because I actually completely forgot about that. Yeah, he sent a full video with like going through each individual section and where it was going to move. And I completely forgot about that. That was even better than the response on the thing. I'm sorry.
Right. I forgot about it too, or we would have mentioned it earlier. So I'm sorry about that. And then overall, can you just talk about your interaction with our staff, just how they've been, able, like you said, during COVID, we were able to mail you your trays because we couldn't get to you for your actual appointment. Just kind of, I know you work closely with Loretta and Saris. So if you can talk a little bit about just our staff and just how they're accommodating to the adult environment.
Yeah, so especially when COVID first hit and just all of as I touch my face, sorry, as we, everything kind of rolled into that was one of those things of like, how am I going to get down there for a consult? Because I think it was like literally right up, my appointment was supposed to be right as you guys were shutting down. And so they honestly made it, even the front desk, I apologize, I don't remember who I talked to at the front desk, but very helpful just in that sense of like, hey, we're going to get you your extra trays. We're going to go ahead and send you the next 4 weeks out. Then we're going to have a consult with Dr. Jason. Lorena has been great too. Every time I've gone, even when I was there, I mean, she, everybody had like the proper protection on, making sure that everything was super clean. And then obviously additional hand washing and all the things were there, but it didn't feel weird. It was one of those things where it's like, I knew I had to wash my hands a lot more. Because I am kind of taking my trays in and out. So it is one of those things that like I was already heightened to that. But it wasn't a strange thing. I mean, I think they set the expectations very well of like, this is what we're going to do when we get here. We're going to make sure that this stuff is done. Make sure you throw this thing away here, wash your hands over here. We'll go back and forth. But just, that was the one visit, but everything else, you guys have mailed them out pretty quickly. So I kind of get up to that point where if I needed a tray, and it was probably my fault that I didn't automatically say something about it, but it was one of those, it was like, it was quick to get to me, sent me all the additional trays. And we had talked about it too, of like making sure to go through, like I have my set day every single week that I swap trays out, and actually it's tomorrow morning. So these are the old ones. I'll be swapping them out tomorrow, but just setting those expectations. Any communication has been super fast, and even getting there, like the process of pulling in, telling where my station was, calling in, they came out, everything just worked pretty smoothly. I was really impressed, honestly. So it was pretty cool.
Well, we hope we're doing a good job. We feel like we're trying to go that step that the state is requiring, and then we always like to go the extra step just to make sure that everyone is comfortable. So I appreciate that feedback on that. So I just, do you have anything else you might want to say to anybody out there that might be on the fence about starting orthodontics as an adult?
Yeah, absolutely. So, I mean, Amy, when you reached out to me and we were talking about this, I think it was one of those things that I didn't think immediately of PDA No as one that could do this for me. I had another dentist as well, and it was always kind of like up in the air. Maybe they could. It was never just one of those things. And so you and I started that conversation because obviously our kids go there, and so I'm like, yeah, we do this. Like, let's see what that would look like. And to me, I did think, I was like, this may be kind of weird as just the dad rolling in with no kids, because we're used to bringing the kids. But it wasn't. It was just really laid back. And as you said, the orthodontic side in Fayetteville is one of those that it doesn't feel as young, right? And so it is one of those things that just felt normal. Again, the staff is great and everybody's been great. But also just going through this process has helped me. It's kind of given me a little more confidence as well. They're not as hard to talk in. I don't know. I may, after this video, people are like, man, I didn't understand that guy at all. But I don't feel like it is one of those things like I keep them in all the time. I'm used to them. I've been able to, like I said, they send everything to make sure that you keep up with them as well. And you just get into routine. I mean, it's the 21-day habit, you know, it's just, you get into that routine and it just becomes part of your life. And I don't ever think about it. And I would say that if there's somebody out there that is looking to do this, I just do it. I mean, call the office up there, make sure you get in touch with somebody, and Dr. Jason to help. His whole team has been just phenomenal. And so it is one of those things I think you just need to take the plunge. It's super easy. I mean, I don't have to worry about having, you know, the actual wire braces either too, but I think even that would be fine. Just because in our day and age, people are used to that. You know what I mean? Adults having braces is not as a big of a deal 30 years ago when you're a kid. You know, it's not as big of a deal to see an adult in braces. And actually it just gives you a level of confidence, again, that I, even just wearing these has given me that confidence. So I'm really excited to finish out this process and just kind of get back to having a confident smile again. So, yeah.
Well, I bet it's going to happen, and it's going to happen soon. You're fairly close. You're about 75% through, something like that.
Yeah.
But again, I just want to personally say thank you for coming on, giving us your time, giving us your feedback. For that, we really appreciate it. I know this is probably a lot of stuff that people as parents and busy dads, you know, they have questions and they don't necessarily have time to like call and pick up the phone, or you know, they don't have time to come in for a technical full consult, not knowing full well what's going to happen. So we really appreciate it. I know Dr. Jason really appreciates you coming on. And we just want to say thank you one more time. So everybody, Bryan Fittin.
Thank you, guys.
Thank you, Bryan.
Appreciate it.
Thank you. I'm going to finish up a little bit earlier today on one of our social media handles. We asked some questions. So we wanted to know what questions, actually, we asked you to ask us some questions. And we wanted to know what you might want to know as an adult when it comes to orthodontic care. So kind of what were your burning questions, as in the things that you wanted to be able to ask us, but you don't have to come in for a consult. So one of those was, are there payment options? And absolutely, yes. We will work with your insurance company. If your insurance company allows orthodontic benefits for adults, we'll work with your insurance company. We'll set you up on some automatic payments that come out once a month. It's super duper easy. We will work with you within the confines of your financing and all that kind of stuff. So yes, definitely do not let the financing hold you back. We will definitely take care of you. And then another question that we have is it more difficult to fix adult teeth with braces than with a child? And technically, yes. So, and no. So there's two reasons. Number one, most cases are not going to be difficult. Most cases are going to be just straightforward, either a clear braces situation or an Invisalign type situation, okay? But some cases, especially for adults that might be missing a tooth, or they had to lose a tooth due to some decay problems, or they're having periodontal issues or gum issues, you know, those cases can take possibly a little bit longer, or maybe a little bit more difficult to get something to move. But overall, it's about the same. So on it, because children have issues with things as well, you know, so overall it comes down to it's about the same. But if there are underlying oral health issues outside of just the straightening the teeth, sometimes that can take a little bit of time. We will work closely with your general dentist. As Bryan was talking a little bit before, you know, he had a general dentist that he was seeing. He had some work done, had to make sure his cleaning was all up to date before we would start the orthodontics. But we will work with your general dentist to make sure that all the treatment that's being completed by them is also being incorporated in with your orthodontic care. And then we had another fabulous Facebook guest ask us if we maintain or replace permanent retainers for adults. So in most cases, we can bring you in for a consult and see where you're at. So if for some reason you're like Bryan and you've lost your retainers and you didn't wear them for years, that type of case may end up being a new orthodontic case. But if you've been consistently wearing your retainers, wearing them, you know, over the course of the time that you've been out of braces, and you're just needing a replacement from like a most recent loss of your retainers, then that's usually something that we can definitely bring you in and get some new replacement retainers made for you. There's obviously a charge for those. If you've had your orthodontic care with us, obviously we can do any kind of follow-up retainers that you would need. But if you've had orthodontic care in the past with a different orthodontist or as a teenager and you're wanting those replacements, we would probably bring you in for a consult, see kind of where we were at and see if that was something that if we were comfortable with retaining where your teeth are at that time, or if we're going to recommend some different types of orthodontics to maybe help tweak some things that may have gotten out of position in that time since you've been wearing your retainers. And then Amber asked, do you think the Invisalign trays are as effective as wire braces? And yes. So they have come along so far since the beginning of using clear aligners. And I always say the word clear aligners because we use Invisalign and another type of clear aligner. So anytime you're using some type of aligner, you want to make sure that you are doing that while coinciding with an orthodontist. So you want to make sure that you are getting the recommendations from an actual orthodontist on what to do about your aligners. But then wire braces are the same thing. Obviously, you need the orthodontist for that, but they're all moving your teeth with the same mechanisms. It's just a little bit of a different tool being used to do that, okay? And then Miss Jessica asked, is there a fee for a consultation? And the answer to that is absolutely not. All of our consultations are free. That includes your photos that you would need and any type of scans or x-rays that are included in that. And usually those appointments last about an hour. You would meet with Dr. Jason and his treatment coordinator. So Miss Tina is a treatment coordinator. She would come in, she'd talk to you kind of about what your concerns are, what your wants are as far as what type of appliances are you looking at. She'll talk to you a little bit about your insurance. Then she'll take some photos. She'll take the scans or any x-rays that are needed for that. And then they'll get together. Dr. Jason will come in and ask you a series of questions. And then by the end of that appointment, you will have a full workup of what we're recommending, as well as the cost and what any insurance might be covered for that, okay? And then the last question we had is, which insurances do we take or accept? And technically, we accept almost any insurance. Now, we are only in network with Delta Dental of Arkansas, Blue Cross Blue Shield, and Cigna. But with orthodontics, most of the time you do not have to go to an in-network provider because you still get your full orthodontic benefits regardless of whether or not you're seeing someone who's in network or not. And so sometimes there might be a tiny discount that's allowed if we're an in-network provider, but most of the time our fees are underneath that allowable amount anyway. So you don't really see a huge difference in that. Now, that's not for every insurance, and it's not going to cover every single plan and every single employer. But for the most part, you would not be losing any benefits by going to an orthodontist who's considered out of network on your plan. But if you have any questions about your orthodontic coverage, if you're interested in an orthodontic consult with Dr. Jason, and maybe the insurance issues are holding you back from that, feel free to call us. We'll do some investigating for you. We'll call your insurance company, see how those benefits are working for you, and try to get that information to you. And then we can set you up for a consult if you're interested. Again, consults are completely free. Another way that you can kind of get a jump on doing the consult without having to come into our practice, especially during this time frame with COVID-19 happening, is you can go to our website, smilesarwild.com, and you can find our virtual consult tool. It can be found on the left-hand side of the screen. It's a turquoise blue bar. It's the same color as our logo. Or you can find the orthodontics tab on the website, and underneath that, it will say virtual consult. Once you start that process, you'll get an account set up, and then everything will be emailed or texted to you as far as when your results are ready and when Dr. Jason has answered some of those questions for you. So if you're ready to get started today and you just want to kind of get a jump on that, go ahead and head over to the website and get your virtual consult set up right now. The photos are super easy to load. And I know that Dr. Jason looks forward to seeing many new smiles in his office. I just want to sign off by saying thank you so much for watching us today. If you have any questions, you can always feel free to email me at amy@smilesarwild.com. If you would like to schedule an in-person consult with Dr. Jason, please call our office. It's 479-582-0600. And if you are not already following us on all of our social media handles, please search Smiles Are Wild on Facebook and Instagram. You can also find this video and many more on our YouTube channel by searching Pediatric Dental Associates in Orthodontics. Thank you all for watching. Bye.
Thank you so much for watching. Make sure to subscribe and go visit us on smilesarwild.com.